be careful when the examiner is trying to prompt you. And if the discussion is
Okay.
proceeding straightforward, that means you're doing good.
Yeah.
If the examiner
Okay.
is interrupting you and asking you on questioning you, this is for everyone. In this video, we aim to cover the topic of obesity through the clinical examination in one of our sessions. Although this topic seems quite simple, but a lot of candidates do get caught out, and it's also important not just for but actual clinical practice. So let's see how the candidate performs. Yeah. So you now enter the station. So when you enter the station, you see Rebecca with a mom. Rebecca appears to be quite generous in size. She appears quite tall, and yeah, you can proceed. So these are the cues which I'm giving, which you would be obviously seeing.
Tall and plus
Quite generous in size.
okay. So okay. It means her weight is more than her age.
I can't give you the objective values, but as
Okay.
you when you see any person, I can just describe you how the person is looking at their initial impression. If you ask me
Okay.
what you would be doing or what you would be actually doing in the station, and then I can provide you with the with whatever cues you need. Yeah. So
Okay.
you start your examination now.
Okay. Hello, my name is Dr. Hafiza. I'm one of the pediatric doctor in the department.
Yeah.
Um,
Hi.
may I
Nice
ask
to meet you.
Nice to meet you too. May I ask your name and age, please?
So my name is Rebecca, and I'm 14 years old.
Okay, and she's your mom, right?
Yeah.
Okay, and so what is her name?
She's called Jane.
Okay, so okay, and thank you, Rebecca. So Rebecca, how are you doing today?
Yeah, I'm good, thank you.
Okay, so Rebecca, I'm here to examine your to do your general physical examination, and so may I proceed?
Yes, please go on.
Okay, and so first of all, I will have a general look of my patient.
Yeah.
Okay.
So as I described, the patient looks quite generous in size, tall, well built,
Well built.
and
Okay.
appears well. No stigmata of chronic illnesses.
Okay. Appears well. Okay. And so.
And no obvious dysmorphisms.
Okay. No dysmorphism. Okay. Okay. So Rebecca, um, first I would like to start my examination from your weight and height. Is that all right?
Yeah, that's fine. So when you've gathered the weight. So before you came in, the nurse already took the weight and the height, which was so this is the growth chart that was plotted for her. As you can see, the marks in the green here. So this is where the Rebecca's centile is. Are you able to appreciate and see?
Yeah. Yes. Between 98 and 99.
Yeah. So what else would you like to do?
So this is weight, right?
Yeah, this is the weight
BMI.
and the height. This is the BMI chart.
Yeah.
Sorry, the weight and the height was above 95th centile. Both the weight and the height was above 95th centile.
Okay. Okay. So now I would like to start from the hand, and I will do. I will check for the nails for any clubbing, any any hemorrhages, and I will. Is there any
So yeah,
finding?
you proceed on with the examination of the hand. There are no signs evident on the hand. Hand looks normal. You can proceed on. Carry on.
Okay, then I will take the pulse and
Yeah,
so pulse. I will
the
check the
pulse is
radiator.
regular. The pulse is regular,
Okay,
and when you look at the, yeah, you can proceed on, carry on.
okay. So I will also mm, I will also check the other side of the pulse and will compare with the radio radial and the radio femoral delay.
So you do not appreciate the. It is all normal. There is no radio radial delay, and it's hard to get the radio femoral delay if the girl is standing.
Okay,
Yeah,
so
go on.
I will go up and I will take the blood pressure.
Fine. Okay, continue.
Okay, so BP is blood pressure normal?
Blood pressure is on the higher side, but that will take a lot of time. You're not expected to do that. So continue.
Okay, so now I will go towards the face. So I will look in the eyes any jaundice. So could you please look up?
No,
Uh,
so there is no jaundice, no pallor in the eyes.
no jaundice, no pallor. Okay, so could you please open your mouth? Uh,
Yeah. So the
yes.
mouth, yeah, its mouth is fine.
Okay, mouth is fine. Okay,
And
now
this
I
is
will.
this is how Rebecca looks.
Okay, so now I will come into the neck and will check is there any
So
pulsation?
um, yeah, on the neck there is when you inspect the neck, you see this.
Okay, um, okay, black discoloration.
Yeah.
Okay, and there is also okay. Then I will okay, then I will go down towards the legs and I will see is there any edema, pedal edema or not?
No, there's no pedal edema.
Okay. Um. Okay. And yeah, yes, I forgot to check the capillary refill time.
Yeah, that
What?
is fine.
Okay. Um. Okay. What else? Okay. Yes. Now I will check the all the lymph glands of the Rebecca.
So lymphatic glands, I'm not sure what you would be looking for, but the time is up now.
Okay.
Yeah, do you want to give your closing remarks?
Yes, thank you very much, Rebecca, for your cooperation. Um, and
What else would you like to examine any other system, any other thing?
yes, I need to check. Yes, blood pressure is important, and
Yeah, so you got the blood pressure was on the higher side. Her blood pressure was 142 on 94.
okay, yeah,
So
heart.
what is your impression? What do you think it is based on
Okay,
your based on your findings? So here you got the growth chart. You
yeah,
got these numbers.
yeah.
What do you think is going on?
So I think patient is on. Maybe the patient is.
What are the features of Cushingoid? How do you find? What do you expect in terms of body fat distribution? And what
Yes,
are the other things you find?
yes, that is the central obesity kind of the things,
So
and
did you appreciate any central obesity in here?
yes, tummy was looks like
Um, Fine, but there's a particular pattern described in Cushingoid where you note a remarkable distribution of fat.
okay. There is
Yeah,
trias and
fine. So and any other possibilities apart from Cushingoid?
yes, there should be steroid intake. That is also the question mark.
So you think secondary to drug intake, is it?
Yeah.
which could be a steroid. And
Yeah.
fine, any other possibility?
Yes. If we will see the BP, we can think about the renal disease, but the pedal edema was absent, so I will not go with that.
Fine. And how would you expect the weight and the height in Cushingoid?
So weight and height um, will be higher. BMI will be high.
The BMI will be high, I agree. What about the weight and the height?
So height will be shorter and weight will be high.
Okay. And what was the in this instance, did so as I mentioned, Rebecca's height was on the higher side. So
Yes.
do you think that adds up?
No.
Fine. So what are the complications, and how would you manage?
Um. Yes. So so it means my diagnosis is wrong, right?
You can continue. What do you think is the complication, and how would you manage?
Okay, so complications are the high blood pressure that can lead to the any heart problems and the stroke.
Yeah.
And
Fine.
so first we will.
Fine. What investigations you would do, and what other complications can you think of?
Okay, so I will do some routine blood test and blood sugar levels.
Okay, so the time is up now. So that was the attempt from the candidate with regards to the clinical examination. So let's see some of the highlights of the discussion that we've had subsequently.
The differentials would be like something like Prader-Willi or um, overgrown would be Sotos
So
or
yeah, we'll go into the discussion part, but in terms of examination, how would you?
a blood glucose monitoring or an oral glucose tolerance test or an HbA1c would be providing us a lot of data into how is this how is it going on or
Fine.
what's the trend.
Yeah, that's right. So it's pretty much I mean well covered. Includes I mean overall appearance. You would so I would say you would be probably marked here in this part. You did pick up signs. I didn't. Ma'am, did you mention acanthosis nigricans in your summary?
No.
Ask you what are those signs. It will come here
Okay.
some minor errors in the interpretation of the
Okay.
signs. So
Okay.
they may mark you here in this part. So and then the clinical reasoning, I think you kind of jumbled up. So it was kind of all over the place. The examiners, if they don't like it, it goes here. Yeah,
Some
the,
blood
the moment the moment you mention the word obesity, it will not go down well. This is quite a sensitive and political topic here. You can't use this word obesity, fat. The moment you mention this, um, the role player will get offended, and the most common side effect is the fat malabsorption.
Okay.
Nowadays they are
Okay.
using semaglutide Ozempic a lot.
Yes, that is called as GLP-1 um,
Analog.
agonist. It's, yeah, so that is called as semaglutide, which is a recent one. I mean, if you mention, you'll be getting brownie points for that. If you just mention GLP-1 agonist, that's fine. Otherwise, the examples are semaglutide, and you have something called as a liraglutide from the UK, and they classified the causes as syndromic. That kind of covers. We'll go through all that syndromic ones, and then you have leptin pathways. This is again some kind of mutation, which is the genetic one, which we are broadly talking about. But more specifically, they described it as leptin pathway. And then you have endocrine causes. Okay. And then the other causes they mentioned were, which you mentioned the child is well or unwell, and no features of dysmorphism, and plotting high. And then you mentioned the growth of the child.
Okay.
And then you mentioned the other positive findings that. So to find out more, please join our WhatsApp and Telegram group.